Hello, and thank you for joining us today for the first program in the Alumni Weekend at the Harvard T.H. Chan School of Public Health, The Right to Health, Equity, and Justice for All. I'm Dr. Carmon Davis, the immediate past president of the Alumni Association. I'm pleased to introduce today's program, Under the Roof, Using Housing to Improve Health, with Dr. Gary Adamkiewicz, who is a fellow graduate from the Harvard Chan with an MPH in 2002. Dr. Adamkiewicz serves as the Associate Professor of Environmental Health and Exposure Disparities in the Environmental Health Department at Harvard Chan. He also serves as the Director of Healthy Cities Lab, a lab that is working to develop and improve the methods of quantifying environmental exposures and health risk in ways that inform outreach, intervention, and public policy. I would also like to introduce today's conversation moderator, Angelica Johnson. Angelica is a recent MPH graduate from the class of 2022 and serves as an alumni counselor representing her class. Angelica?
Thank you, Carmen. Welcome, everyone, and thank you for joining us today. We're here to delve into a crucial and pressing topic, one that affects communities around the world, and that is the connection between housing and health. Environmental racism, at its core, addresses the systemic inequities that lead to disproportionate environmental burdens on marginalized communities. These burdens can lead to an increased rates of asthma, respiratory disease, and a host of other health problems. I'm here today with Dr. Gary Adamkiewicz, whose research revolves around environmental disparities and how housing, communities, and neighborhoods shape our health. Dr. Adamkiewicz, thank you so much for being with us today.
My pleasure. Thank you, Angelica. All right, should I start?
Yes, thank you so much.
Okay. Well, thank you, Angelica. Thank you, Dr. Davis. It's a pleasure for me to be here with you, all of you today. I'm a big fan of the Alumni Association. I think it's a great way to really connect some of the great work happening at the School of Public Health with the universe of folks who might care and have a special connection to public health. So let me just start to share my screen. Okay, can you see that, Angelica? You could just...
Yes, I can see it. It's showing very well. Thank you.
Okay, great. So as was said, the title of my talk is Under the Roof, Using Housing to Improve Health. My talk today is really in two parts. I'm first going to talk about some of the work we've done over the years to address environmental issues within public housing, which I hope highlights some of the connections between housing conditions and health and what can be done about it. And then I'm going to finish with a broader view of some of the content we've created around environmental racism in Boston, which I think folks may be interested in. But really looking forward to giving the presentation, but obviously also looking forward to getting any questions that you all may have. So just to start, I'd like everyone, I know we're in a virtual setting here, but I want everyone to take a deep breath and let it go. And the reason I want to do that is not only to calm everyone and center everyone, but really to highlight the fact that you just took a breath indoors, and 9 out of 10 breaths we all take happen indoors. And that makes indoor environments especially important microenvironments to understand when it comes to health. We're breathing this air that is, conditioned and separated from the outdoor air, and there are sources indoors that may matter for health. So understanding home environments, workplace environments, school environments is really important. Today, I'm really going to focus on the home environment. And before I dive into some of the specific work, I want to emphasize that, no matter what you do about your indoor environment, where your home sits is really important. So the air inside, in many cases, originates outdoors that we breathe. And so if your house is situated in a polluted environment, then you are likely going to be breathing polluted air indoors. And this is really at the heart of the environmental justice movement that has existed for decades in this country. And there's still so much to do related to addressing, neighborhood level exposures in affected communities. So that fight continues. Today, we're going to take a detour and really focus on how environmental justice is related to indoor exposures and what we can do about it. So the picture I'm showing now reflects many of the indoor environmental exposures that we've studied over the past 40 to 50 years that could be related to health problems that originate in the home. So towards the upper right, you see some peeling paint. One of the issues that people immediately think of is lead paint exposure, which is a problem where we've come a long way, but there's still a long way to go. There's still a lot of housing in the United States that has lead paint hazards. And every year children show up to the ER or show up in surveillance testing as being having elevated lead levels. And that's something we still need to address. On the upper left-hand corner, we see cigarette smoking. Cigarette smoking is still an issue. And the evidence shows that living with a heavy smoker is the same, imparts the same risk as being a light smoker yourself. So there's still a ways to go in that regard. Towards the upper left, I have a picture of a gas stove. You may have seen things in the news about gas stoves being bad for your health, and we'll touch on that a little bit. But there are all sorts of exposures in the home, from pest problems to mold and moisture to chemical exposures. On the bottom left, I show pesticides that are introduced into our home in many settings. And I also have pictures of outdoor air pollution, underscoring the point I just made about outdoor air pollution being a prominent factor. I also have a picture towards the left of composite wood products, which can emit formaldehyde into the home. So anytime you see that particle board material that may comprise a bookshelf or a bookcase, that material can release formaldehyde into the home. So a lot of things to be concerned about. The good news is we've learned a lot about a lot of these individual exposures, and we've tried to address some of them. What I'm putting now are the chemicals and the situations that relate to each one of these photos, and we can discuss these when we have questions and answers. So what I'm going to talk about today is really a case study of what work we've done in the setting of public housing in the city of Boston. So more than 2 million people in the United States live in public housing. In Boston, the Boston Housing Authority, which runs the public housing program, is actually the largest landlord in the city of Boston. You may have seen buildings that look like this. Most Boston public housing is comprised of 3 or 4 story walk-up buildings that are brick that look just like this. And for about 20 years, I and others at the School of Public Health, including Jack Spengler, my mentor, have been working on trying to improve conditions within public housing. So one question you may ask is why work in public housing? Why focus research in this area? Originally, 20 years ago, it was motivated by asthma concerns. It wasn't unusual to find that 25 or 30% of the children at a particular development were diagnosed with asthma. When asthma rates are normally around 10%, this is highly unusual. And so so this really raises a flag as something's unusual here in terms of the disease burden within this population. Starting in the early 2000s, we started looking at indoor environmental exposures and risk factors. So we looked at allergens coming from things like dust mites and cockroaches, combustion byproducts coming from gas stoves. We looked at pesticides, smoking, inadequate ventilation. We also tried to look at multiple exposures, how all these things come together. And we found a fair amount of evidence that families living in public housing were more highly exposed than the general population. And I should say, even if we weren't successful in finding what caused someone to develop asthma, knowing that asthma rates were this high really raises the bar for us to eliminate some of these exposures. So asthmatics are more sensitive to some of these environmental triggers than a child without asthma, for example. So this disease burden really highlights the vulnerability for this population in terms of environmental triggers. So we, as researchers, we want to answer both questions. What causes someone to develop asthma, as well as what's going to trigger an asthma attack or an asthma episode. The other reason we worked with public housing was the opportunity for intervention. So as I mentioned, the Boston Housing Authority is the largest landlord in the city of Boston. Working with a single landlord raises the possibility that we can identify strategies for intervention that will affect more than the population we enroll in a study. For example, some of our studies involve 100, 200, 300 people or families within the Boston Housing Authority. Meanwhile, more than 25,000 people live in Boston public housing. So working with the housing authority allowed us to identify strategies for intervention. And that actually came to fruition over the years that we've worked with them. And we can touch on those if you have any interest. So the question is, once you identify these problems within housing, and once again, I'm not saying that these problems are exclusive to public housing. There are lots of these issues within the private market. It just turns out it's actually harder to study the private market because private landlords are generally reluctant to go in search of problems working with researchers, whereas the Public Housing Authority was very open to working closely with us to identify issues and hopefully solve them. So the first place we might think to intervene is on place. So how do we build better housing? How do we renovate housing? How do we operate housing in a healthy way? But the other two places, the other two Ps, I think of these as the three Ps, people, places, and policies. The other two Ps are people and policies. There's work to be done in terms of direct education to those who live in housing that's affected by environmental issues, as well as on policies. And here I'm not talking about national policy. I'm talking about just the policies that are in place that to run and operate low-income housing or public housing. So, for example, you may have a smoke-free policy, not allowing any smoking indoors. You may have a pest control policy that doesn't focus solely on applying pesticides into people's homes and potentially overexposing families to these harmful chemicals. So, but both of those are examples of things that the Boston Housing Authority has done over the years that we've been involved in. So here are some examples of interventions that we've worked with the Housing Authority on. They have redeveloped some properties to green standards, and I'll explain what that means. They've adopted better pest control policies, once again, not relying on just dosing apartments with harmful chemicals. We've focused on resident education. There are interventions related to chemical exposures. And in 2012, the Boston Housing Authority became the largest housing authority in the country to go smoke-free. Since then, it's now national policy for public housing to be smoke-free, but BHA was actually ahead of the curve. But for today's presentation, since we don't have infinite time, I'm going to talk about these green transitions, these redevelopments that were aimed at creating green and ultimately, more importantly, I think from my perspective, healthy housing. So the first thing we did, the Housing Authority underwent a redevelopment at one of its properties called Old Colony, which is in South Boston. This is more than 800 units of housing that has existed for more than 80 years, or at that point, I guess 70 years. The goal was to really redevelop this property in phases. Here's a picture of some of the new buildings that were constructed on site. Not only did they create new buildings, they built a really nice community center. Here's what the property looked like in the 1940s. The property was originally constructed in 1940. As you can see, in terms of design, it leaves a lot to be desired. This doesn't necessarily blend in with the neighborhood, but the goal was really to provide housing to working families. There's a long history of public housing programs in the United States that I won't be able to get into, but this wasn't for really people who were unemployed. This was mainly targeting at that time folks who were employed and just didn't have sufficient income to enter the private market. But here's a picture I really like, which really shows this intervention in progress. So I mentioned this first phase of the development was 116 units. There were more than 800 units on the site. So this sort of happened in phases over the last 15 years. And what you see on the left are the new buildings that were constructed. What you see on the right are the old buildings. What this sets up is for a researcher is basically a natural experiment. In many ways, housing studies are difficult because they're confounded by cost and neighborhood. If I wanted to do a study of green building in the city of Boston, for example, most of that would be confounded by the fact that the green properties were owned by higher income families and existed in higher income neighborhoods. Here we're building new, modern, green, and healthy buildings on the property of this development within the Boston Housing Authority portfolio. So the families are similar. Basically, the demographics are similar on the left-hand side of your screen to the right-hand side of your screen. The neighborhood is the same. And so we don't have some of these methodological issues in terms of doing a study. And so what we wanted to see is how can housing ultimately really improve health? What happens when families move from conventional housing with all the problems I previously mentioned into green housing, which eliminates so many of these risk factors? So I'll take a pause, one step back and talk about green building. So green building is the practice of creating and using processes that are environmentally responsible and resource efficient throughout a building's life cycle, from siting to design, construction, operation, maintenance, renovation, and deconstruction. That's a mouthful. But basically, the focus on green building historically has been on resource efficiency and energy efficiency. But as this methodology developed, there has been more emphasis on creating buildings that are not only resource efficient and energy efficient, but that are also healthy. So even though it costs money and energy to ventilate a building, green buildings are properly ventilated to provide healthy and clean air to residents where they need it, for example. So the buildings that were created are both achieving energy efficiency as well as being healthy. In picture form, this is basically this represents some of the transitions that were happening going from conventional to green. On the conventional side, when these buildings were first conceived, there was smoking allowed. They had gas stoves. They had many what I would call unintended airflows in the buildings. So they were kind of leaky buildings without controlled airflow. On the green side, smoking wasn't allowed. You had furnishings and building materials that were low emitting, that weren't emitting chemicals into the air. And you basically had a very tight building shell. So these buildings were built to be energy efficient and tight, not allowing a lot of airflow, but they provided active ventilation in places where you need it, like a kitchen and a bathroom. So these represent the big transitions going from the conventional to the green side. So our goal was really to look at what can this combination provide for the families living in public housing in terms of people, places, and policies, in terms of comfort, satisfaction, environmental exposures, health, and energy usage. So the first thing we did is we measured pre-post levels of key pollutants that we know are problematic for health. The first one we measured is called nitrogen dioxide. Nitrogen dioxide is a pollutant we find in urban environments. that comes from any form of combustion. So it comes from cars, trucks. It also comes from your gas stove. So the fact that we replaced gas stoves with electric stoves means we had an ability to reduce nitrogen dioxide exposure. And I should explain this figure. Every green line represents a family who was in conventional housing in year 1 and green in year 2. Every black line represents families who were in conventional housing in both years, and you can see all the green lines sort of slope downward. And what we found is that there was a 66% reduction in NO2 concentrations in these homes. We also found for these families that there was 47% fewer symptoms related to symptoms that we would normally call sick building syndrome symptoms. But anyway, so because of this elimination of the gas stoves, we're able to see this significant reduction in NO2. I should mention that subsequent to this study, we've done a lot of work measuring air pollution in real time in people's homes in the greater Boston area, specifically in places like Dorchester and Chelsea. We've used sensor boxes like this. What is clear, there's no mystery about the fact that gas stoves, when you use them, emit NO2, this harmful pollutant, into the air. Just as an example, I'm showing you the NO2 concentrations in the gray lines between a home that has an electric stove and a home that has a gas stove. And what I've highlighted in red here are the times when people were using the stove. So what you can see here is that every time you use a gas stove, you're injecting nitrogen dioxide or this harmful pollutant into your home. And the reason we originally studied NO2 in this project was because it's regulated as an outdoor air pollutant by the Environmental Protection Agency, because we know that there are health effects from its exposure. And in this case, the indoor air isn't regulated. So this is a place where people are exposed unknowingly to this pollutant. You may have also seen other things in the news about gas leakage, how gas distribution lines to homes in places like Boston can leak natural gas into the environment. This is a problem for climate change. So this is what has led people to sort of question our entire system of using gas stoves and using natural gas in our homes, to heat or to cook, because it's contributing both to climate change as well as potentially the health effects of folks who live in homes where they're using gas stoves. So that's a little bit of an aside, but just wanted to provide that context because many of you may have read stories in the news about gas stoves being bad. The other pollutant we measured is something called PM 2.5. That stands for particulate matter smaller than 2.5 microns. And I know that's a foreign term to many of you, but what it means these are the small particles in the air that you can't necessarily see that can penetrate deep into your lung and cause health problems. We also saw, on average, a 41% decline in PM 2.5 levels going from the conventional into the green homes. And the reason for that is really that we eliminated smoking. We also provided proper ventilation as opposed to providing recirculating fans. Many of you may be in the Boston area, may be familiar with recirculating fans that basically just filter air and send it back into the unit. All of these new green buildings had ventilation that exhausted to the outside. So the ventilation in the kitchen and the bathroom both send air to the outside, which can reduce levels of fine particles indoors. Another thing we found is that there were fewer particles of outdoor origin in these homes, and we used a special technique to determine that. So the buildings, because they were tight buildings, they're basically acting as a filter to outdoor air. So all of that combined to provide this reduction in PM 2.5, which has been shown in hundreds of studies to be associated with health outcomes we care about. So the real thing I want to underscore is the fact that we looked at health outcomes. And this is where we found the most shocking results. So we didn't recruit families into our study based on whether they had asthma or not, but because we're in public housing, many of the individuals in the families did have asthma. We found that asthma symptoms were 2.9 times higher on the conventional side compared to the green side. Asthma attacks occurred at a rate 3.2 times higher on the conventional side. Hospital visits, 4.2 times higher on the conventional side compared to the green side. Missed school for asthma, 4.8 times higher. So if we were talking about a pharmaceutical intervention, this would be front page news. But because it's housing and this is just, meant to be a social intervention, this doesn't necessarily get the press it deserves. But we really found pretty striking differences in health comparing the conventional to the green side. So I won't go over every last detail, but what we really tried to do was look at this green balance sheet. We found that indoor air quality was improved on the green side. And I should emphasize the green and healthy side. Health improved on the green side compared to the conventional homes. We actually also did a study. Not only were these buildings bad for health, they were also highly energy efficient in terms of electricity, gas, and water. We found that this first phase, which just involved over 100 and something buildings intervened on, that intervention was saving almost $600,000 a year. So if you think about monetizing these health benefits and monetizing the energy efficiency changes, this turns out to be a significant savings. We found thermal comfort improvements. One thing we did find, though, is that since families were generally used to overheated apartments, it's really common in Boston Housing Authority to have steam heat and have overheated apartments, that some of the people reported that the new apartments, they felt cold or they resorted to some spot heating. In most cases, that tended to resolve over a year of being in the unit. So people got used to being in a properly heated apartment as opposed to being in an overheated apartment. We also found some evidence for increased sleep duration, which is good for everybody's health. So the bottom line here is that I want to emphasize that your home affects your health. A lot of different environmental exposures happen within the home. People, places, and policies matter. Indoor sources and indoor exposure to outdoor sources matter. We do still need more research on the full balance sheet, how it relates to quality of life. For example, we didn't look at educational outcomes for the children who moved into the green units. I wouldn't be surprised if we saw some improvements there. I should also mention that you can't just build a green building and walk away. Healthy conditions need to be maintained in terms of systems, maintenance, policies, education, and outreach. All of those things you need to keep your eye on so that what was designed to be green and healthy stays green and healthy. So what I'd like to do now is I want to take a step back for the remaining few minutes and talk about a resource that I created along with my colleague, Dr. Tamara James Todd, who's an associate professor within our department, also an associate professor in the EH department, environmental health department. A resource we created that exists online, which was the NIEHS Center Environmental Racism Story Map. This was created with the help of a former research assistant named Lisa Frew. Lisa is currently a doctoral student at Drexel University. But what we tried to do in this resource was really focus on some of the issues I've talked about already. We know that housing has a lot of issues that map onto socioeconomic status and race. We wanted to tell a story about how those processes that the processes related to racism exist in almost every city in the United States and affect things we care about, like housing and healthcare and other factors that shape people's lives. So what we wanted to do was create a resource that could be used by the general public as well as our students, that would be Boston focused, historically situated, highlight research from our NIEHS Center, contain interactive map elements, and look towards solutions with resources for readers. So I'll start with a definition of environmental racism put out by Robert Bullard, who's considered the father of environmental racism. He's based in Houston and a really prolific academic who has worked on these issues since the 1970s. Environmental racism refers to any policy, practice, or directive that differentially affects or disadvantages individuals, groups, or communities based on race or color. It also includes exclusionary and restrictive practices that limit participation by people of color in decision-making boards, commissions, and regulatory bodies. In contrast, like more broadly, we can talk about environmental justice. Environmental justice is the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. And what I tried to do in my career is focus on the environmental injustice of housing-related risk factors, and how through many processes, including some, many factors, including residential segregation, contribute to these issues. So we basically created this story map to focus on 4 areas that we thought would be instructive for people reading it. One is residential segregation. One is environmental racism at the neighborhood level, environmental racism at the household level, and environmental racism in terms of access to personal care products. For residential segregation, we heavily relied on an amazing resource, this book called The Color of Law. And if anyone isn't familiar with it, I highly recommend it. It's an amazing book that came out a couple of years ago by Richard Rothstein, that the subtitle is A Forgotten History of How Our Government Segregated America. We talk about, sometimes when we're talking about segregation, we talk about people living in neighborhoods where they feel comfortable, or people living in neighborhoods they can afford, or people living within communities that look like themselves. But this book really highlights the specific government practices that were racist by design, that have shaped segregation in U.S. cities, and it's really truly a groundbreaking book. One of the things it focused on was residential this idea of residential segregation. You may be familiar with redlining. It also talked about restrictive covenants. This is a case where specifically in purchase agreements, it was forbidden to sell properties decades ago to non-white purchasers. So this really existed until the 1960s. A lot of government sort of sponsored processes like suburbanization of America and urban renewal led to racist practices that affected neighborhoods across the country. We still see many signs of discrimination today, and we still see signs of segregation today. In many cases, that segregation is really shaped by these historical practices such as redlining. But the core thesis of this book is really on the roots of segregation. There's a difference between de facto and de jure segregation. De facto means a state of affairs that is true in fact, but not officially sanctioned. So this might be a theory of segregation saying that people are just living with people who look like them, as opposed to de jure segregation, which is a state of affairs that is in accordance with law. And what this book shows is that there are many specific actions taken by the federal government that really shaped segregated cities as they exist today. So there are several forces that have racialized housing, racism in the private housing market. We'll talk about redlining and restrictive covenants, racism in the public housing market. There are lots of examples of how the federal government put public housing into neighborhoods that were quite integrated, but created housing developments that were only for white residents or only for Black residents. And these other practices, the other processes, which I won't go into in terms of suburbanization, highway construction, and urban renewal. So for those of you who aren't familiar, redlining was a practice that started in the 1930s. As in response to the Great Depression, the Federal Housing Administration was created to help Americans buy homes by helping out with home loans using funds from the federal government. As part of this program, they created the Homeowners Loan Corporation, or HOLC, H-O-L-C. What they did is made maps of 239 US cities, which color-coded neighborhoods based on their appraisal of how safe it was to award a federally backed loan in that area. And they created these distinctions which were fundamentally racist. So if you were in a red zone or a hazardous zone, which is where the term redlining comes from, people in areas with a D grade, as you'll see here, were completely excluded from the federally backed loan program. These areas were usually where people of color, working class, and immigrants lived. And if you look at the documentation behind this program, they're not shy about it. They're quite explicit that a neighborhood was rated D because it had a lot of non-white residents or a lot of immigrant residents. Here's what the map looks like for Boston. You can see that areas around Roxbury and Dorchester are more likely to be labeled as yellow or red, meaning they have a higher risk factor associated with loans that could be awarded in these areas. As I said, they were explicitly racist. The effect of this policy was that federally backed home loans were awarded almost exclusively to white people living in white neighborhoods. Redlining policy excluded people of color and working class families an opportunity to build intergenerational wealth through homeownership. The effects of this racist policy are still in effect today. If you look at the public health literature, redlining, there are a lot of people doing research connecting redlining to outcomes that matter. I did my own scan of the literature. Historic redlining has been associated with environmental conditions, air pollution, asthma, stroke, self-reported health, cardiometabolic risk, and the list goes on and on. So we think of these as historical practices, but they actually shape current conditions today and actually are related to many health outcomes that we care about. I'm going to skip that. Well, I'll show you here. Here's an example of Richmond, Virginia. On the left are the Hulk housing grades. On the right is a current assessment of current social vulnerability index. And you can see that there's a lot of similarity between these maps. But what I'd mainly like to do is point you towards this resource. I thought I didn't want to miss today's opportunity to share this resource with this audience. Here's the website, which I know is a mouthful. If you just Google environmental racism Boston, this story map will be the first thing that comes up. I'd like to close by thanking our funders for the many studies that we've been able to accomplish over the last few years. I'd like to thank so many members of my team who have helped with this work. And if you're interested in more of the work of our lab, just go to the healthycitieslab.org. So I'm a little over time, so apologies for that, but I'm happy to take any questions that Angelica or anyone else has.
Thank you so much. That was such a good presentation. Very, very, very insightful. And I'm sure it's made such an impact on those with us today. Thank you for sharing your expertise with us. I'd like to start off by asking a couple questions.
Sure.
So you've just described how inadequate housing conditions such as lead exposure, poor ventilation, and inadequate sanitation can contribute to health disparities in minority communities. One solution was to build new housing, as you show in your presentation. But aside from building new housing, what steps can be taken to address these issues?
Great question. So there are a lot of things we can do. I don't really want people to walk away from this presentation thinking the only thing to do is like demolish a building and build new. If you look at the lead hazard control program, for example, within the state of Massachusetts, that really targets families who need lead remediation because a child showed up in the hospital with an elevated lead level in their blood. So there are things that can be done in terms of remediating lead hazards in the home. And that pretty much almost exclusively happens in older homes, since we banned lead in paint in 1978. So since since Massachusetts and New England has a lot of older housing stock, there are things to be done there. In terms of everyday life for most people, I just think it's important for people to recognize that there are environmental risks within their homes. So everything from lighting a candle to burning incense releases particles into the home. If you're not using your kitchen exhaust, you should. So every time you cook, you're releasing particles into the air. If you have exhaust above your stove that pushes air to the outside, that it's a true exhaust, you should definitely be using it when you cook, and that can take care of pollutants from gas stoves, as well as just what you produce when frying or cooking, the particles that come off of that. If you have a recirculating fan, one that filters air and blows it back into the room, that won't take care of the emissions from gas stoves. That will take care of just the smoke that you produce when cooking. But I think it's helpful for people to look at all the different sources of air pollution in their home. Everything from smoking, as I mentioned, candles, incense, cooking, these other hazards like lead. The study I presented focused on green new construction, but there's such a thing as green renovation, like renovating homes, weatherizing homes to a higher energy efficiency standard. Those can be opportunities to improve conditions within homes. So I'll stop there because I could just keep going on and on.
Yeah. So we currently have 2 questions from the audience. So I'm going to take those and then we'll come back to questions that I have.
Okay.
Our first question is from Melina Hill Walker. She says, thank you. She is interested to learn the process through which the green units were built. Where did the funding come from? What were the challenges and opportunities in creating those green buildings?
Yeah, it's a great question. So this housing finance today is some of these details are beyond my expertise in terms of putting a package together. But I know that these green buildings were a combination of federal funds and private activity. It really was a public-private partnership. So there were dedicated funds given to the Boston Housing Authority to build new. There was an attempt to build a collaboration with a private developer so that they would take over operation of the units, which I'm also in favor of. I like the idea of BHA being a landlord, but that doesn't mean that they are the ones who manage the site day to day. I like that they're the ultimate landlord, but day to day management can be private. So it was a marriage of private and public funds in a way that allowed this to be developed, and they didn't have initially enough funding to redevelop all 800 properties. That's why it has occurred in stages. There are still programs within the federal government that are funding redevelopments like this, but I would say in terms of my policy wishes, I wish there were even more funds. There are other BHA properties that are being redeveloped. For example, Mary Ellen McCormick, which is next door to Old Colony. But you need an influx of significant federal funds really to make this happen. Do we completely offset that investment with the savings I talked about? Not really. But when you talk about improving people's health and being more energy efficient, I think there's a strong case to be made. We need to modernize all public housing.
Thank you. Our next question is coming from last name Ajayi Obe. What are the cost savings of green housing as related to disease prevention and the overall health economics? And she would like to thank you for this excellent presentation as well.
Yeah, we haven't done a complete cost savings analysis. We've done pieces of this. I think am inspired to continue down this road and probably do a full cost accounting. That's why we did the analysis on the utilities. We showed that for the I always forget the exact number, 120 units, they were saving around $600,000 a year. If you were to monetize, every missed hospital stay saves thousands and thousands of dollars. If you were to monetize that for the entire development, that would turn into hundreds of thousands of dollars in savings over time. So if you add these numbers up, you probably turn this total into a sum in the millions. But that first level of development, I think, costs like $80 million. So it doesn't completely offset. You're not necessarily, it costs a lot of money to build new construction. You're not completely offsetting it, but when you see these benefits, it really makes a compelling case to do things better.
Our next question we have is from Gonzalo. He states that a long time ago, we put together a review of the lit and we thought about housing, asthma, and social violence connection. Did you measure reduction of violence or contextually complex, or was it contextually too complex to measure?
We didn't do that, and I should say part of that is, the practical matter of doing research like this is, this was a really unique opportunity. We had funding from the Department of Housing and Urban Development, which is not as generous as like an NIH grant, for example. So we basically had $1 million, which might sound like a lot of money, but to do comprehensive research, it costs a lot of money to put boots on the ground and get things done. So we didn't look at every outcome that could possibly be in motion with an intervention like this. And in terms of there is a literature out there that shows that, exposure to violence can be a trigger for asthma. That's potentially a pathway, maybe the redevelopment affected neighborhood conditions and neighborhood activity in a way that was beneficial to all the residents there. We didn't explore that pathway, but it's certainly possible that part of the benefit we were seeing was not from what people were breathing, but from what people were experiencing in terms of, basically changing the entire local environment. It's a great question.
And a follow-up from Melina Hill Walker. She wants to know, where could they look to obtain more information about the Green Building Project?
So there's some literature. You can reach out to me. I'll be happy to send folks some of the papers we've written about this. The papers we've written connected to this development and the research papers. I think they're fairly straightforward to read, even though some research articles can be a little dense. I think these are very readable. There's some information on HUD's website. If you Google, the project that we conducted was called BRIGHT, which stood for Boston Residential Investigation on Green and Healthy Transitions. But BRIGHT, if you search for BRIGHT and Old Colony, there are some short write-ups on the web, including HUD's site. Actually, this project received an award from the then Secretary of HUD, Secretary of Housing, for what it was trying to accomplish for Boston residents. But yeah, I would just search BRIGHT, Old Colony, BHA. You'll find some information. If anybody wants to read 2 or 3 research articles, you can just email me, Google my name. I'm easy to find at the School of Public Health.
We'll go back to another question that I have while we wait for more questions from the audience. So in your presentation, you were talking about redlining and other policies that have been explicitly are not necessarily explicitly discriminatory. Do you know of any more that have led to environmental injustice affecting the health of minority populations?
Well, in a way, the unfortunate truth is once you start looking for discriminatory practices, actions, racist actions in modern society, you find them, unfortunately. If you're looking for them, you will find them. So almost every decision that's made that affects a neighborhood could be influenced by um, by racist intent or unintentional racist procedures. So everything from zoning policy to neighborhood investments. I mentioned some of the things that are highlighted in the book, The Color of Law, like even the construction of highways, historically in the United States has happened at the expense of poor neighborhoods and neighborhoods that house Black and brown residents. I mean, there's just no denying that fact. If the in Massachusetts, a recent study was conducted that actually compared the experience of a white family with a Black family in terms of how they interact with realtors, and if they're receiving a voucher. And folks who are receiving a voucher are at a disadvantage in how they interact with the realty system. And Black families were shown in this study to be at a disadvantage in terms of how many properties they were shown or whether they were shown properties at all. So there's still racism in the real estate market as it exists, unfortunately, in the year 2023, as on top of all these historic decisions and practices that have shaped what neighborhoods look like. I realize that answer sounds like it's everything and it's overwhelming, but that's the truth.
Yeah, it is. Yes, it is. The next question that I have is, you shared a success story with the implementation of the green housing here in Boston. Can you share other successful case studies or models of initiatives that have effectively improved housing and health outcomes, especially for minority population?
Yeah, the one setting comes to mind in Seattle, in Kings County. They actually, I talked about these redevelopments in Boston, which are really meant to create efficient and healthy housing for all Boston residents. In Seattle, in Kings County, in Washington State, they actually went one step further and actually created housing specifically for asthmatic residents. So, that were meant to be healthy for folks who are suffering with asthma. So they were designed to that standard to make sure that asthmatics had clean air to breathe and weren't exposed to unnecessary chemicals or particles in the air or things like that. And so they have, when I think about entities around the United States who have been leaders, I would say the Boston Housing Authority certainly has been a leader. We've been happy to be a partner with them over the years. And the folks at the Seattle Kings County Health Department, as well as Seattle Kings County Housing Department, I forget the exact name of that department, has really been, they've been leaders. But there are lots of people who are fighting the green building on the green building front or on the healthy housing front. I'm an advisor to the National Center for Healthy Housing. I also would suggest, if you Google National Center for Healthy Housing, they have a lot of resources that give people tips on improving housing. Another partner I have is the Silent Spring Institute, which is located here in Massachusetts, in Newton. They have a lot of information about chemicals in your home. So if people are interested in that space, just Google Silent Spring Institute, and just it takes a little time to sort of navigate their site, but you can find really great resources there.
Thank you. So we have time for one more question.
Sure.
So I would just like to ask, in what ways can partnerships between local, state, and federal government agencies, community organizations, and private sectors be leveraged to address environmental racism and improve housing quality in minority communities?
Well, I think, I think it really starts with finding folks who believe in the mission. I'll go back to our relationship with the Boston Housing Authority. You know, when people ask me, how do you change the world? I think in many cases, it's not about a giant organization, everyone in a giant organization suddenly being enlightened and agreeing on where they should go. It really depends on a couple of individuals who are in a leadership position who decide we're going to change things. And that was true in the Boston Housing Authority years ago when Sandy Enriquez, who took over as the executive director of the Housing Authority, decided she was going to go on a listening tour of Boston Housing Authority properties and find out what was important to her constituents. And she found that, you know, issues around safety and violence were very important, but she also heard again and again how much of a burden on quality of life the cockroach infestation problem was. And that really led her to really partner with folks at Tufts, folks at Boston University, and folks here at Harvard. And so, and the project that I originally came to Harvard to work on 20 years ago was really a unique combination, a unique collaboration, I should say, between three academic institutions. Normally, academic institutions are competing against each other. This was a case where Boston University, Tufts, and Harvard came together to work together on improving public housing in collaboration with the Boston Housing Authority. There are lots of examples. I'm part of an advisory board to the Massachusetts Asthma Action Partnership. I think that's the acronym MAAP, which is working on asthma issues for the state of Massachusetts. There are lots of the same way you can look for issues of racism and see them everywhere. If you look for people trying to do good work, you can see them everywhere in the state of Massachusetts, as one example. So when you align folks who are trying to improve health with those who are trying to improve housing, and all you need is a champion, one or two champions at these relevant agencies or organizations to really get traction. That's probably not a complete answer to your question, but you know, I would suggest that people just look for like-minded folks. All you need is one leader within an organization to make a difference.
Thank you so much. Those were very wonderful words. And thank you so much for your wonderful and insightful presentation. I want to thank Dr. Adamkiewicz for joining us today to talk about this important topic. It was an excellent way to kick off this Alumni Weekend programming. If you're attending this weekend's event, we'll see you soon. And thank you again, and be well, everyone.
Thanks, Angelica. Thanks,
Thank you so
Dr.
much.
Davis. Appreciate it.